Today we have with us Dr. Rahul Jain, Assistant Professor and Head of Department of Cardio Physiotherapy, Government Physiotherapy College, Raipur. So, welcome to the interview, sir.
Thank you.
Sir, can you tell me about yourself?
Myself, Dr. Rahul Jain. I am working as Assistant Professor and heading the Department of Cardiorespiratory Physiotherapy in this college. As well, I provide my clinical services in the intensive care unit in the Dr. Ambedkar Memorial Hospital, Raipur.
Alright, sir. So, what keeps you connected with the education sector and how has your experience been so far with the institute?
What keeps me connected is that I am working in a teaching institution. Our institution provides both teaching and clinical facilities for the Chhattisgarh states. Students of physiotherapy, I take classes for them for physiotherapy in cardiorespiratory conditions, which orients them towards the knowledge of diseases related to cardiopulmonary disease.
Alright, sir. Sir, being the HOD of Cardiorespiratory of the Government Physiotherapy College, Raipur, so what are your roles and responsibility towards the student?
My roles and responsibilities towards the students are to impart up-to-date and knowledge to the students regarding their subject, which is physiotherapy and cardiorespiratory conditions, clear out their doubts, enhance their skills, make them more comfortable so they feel less feared they are more comfortable in the ICU and they are more apt in handling and assessing the patients who are critically ill.
Alright, sir. So, how does the curriculum of the college ensure student to being prepared for the future?
The curriculum here comprises of two parts. One is the theoretical part and second is the practical part. Theoretical part prepares them about the diseases and their etiological pathology, and mostly we assess on the assessment part of the patient, and in the practical part we train the students in again assessing the patients, hemodynamically monitoring them in the ICU and deciding whether the patients are feasible for physiotherapy treatment or not, and how we can help them to gain their utmost potential and minimize the complications of the patients in the intensive care unit through breathing exercises and other physiotherapy techniques.
Alright, sir. So, how do you try to bring practical approach towards the subject and make it industry oriented or medical industry oriented?
As I have told you before, apart from teaching, we also provide clinical facility of physiotherapy treatment in the intensive care unit in the Ambedkar Hospital here. So we take our students there into the ICU. We provide them the real patients. The students has not to do with the treatment part, but they are mere observers. When we deliver that physiotherapy treatment in the intensive care unit, we teach them about assessing the patient, hemodynamically assessing their stability, and then on hands-on approach, we try to explain each and every technique with minute detailing what we are doing on the patients and help in assessing the critical or the minute issues which come. Means no scenario is same, each scenario is different. So students get a wide variety of exposure when they go into the intensive care unit, and we try to make them as competent in this.
Alright, sir. So, any suggestion you would like to give to current youth and aspiring student?
My suggestion would be to the students will be that you should not fear from the intensive care unit. Your theoretical knowledge is your shield which protects you, and you have got a great responsibility towards your patients. For your physiotherapy techniques, simply posture drainage or breathing exercises, you can minimize a lot of complications which comes to the patients in the intensive care unit when they are prolonged immobilized. And physiotherapy has got a very important role in recovering the patient in the intensive care unit. So a therapist who is good in theoretical knowledge and very competent in clinical assessment skills, he may be very helpful in the intensive care.
Alright, sir. Thank you. And it was nice talking to you and have a nice day, sir.
Thank you.